basic expectations, and I'll say almost to the point that you don't even think about it. And those expectations at a very high level are that there's going to be a provider available to you that has the right expertise and that you can get an appointment with sometime soon and near you, that you'll know what the coverage is, which is to say you're working with a provider that the insurance company has made available. They probably are trained and capable of deciding what kind of care you need or your family member needs. And then you'll progress with the treatment, and that'll move along in terms of coverage. And then finally, the claims will be paid subject to deductibles or co-pays, what have you. And if there's a dispute or something that needs to be clarified, you'll do that with the interest of the health of the individual who's getting the care in mind, right? So these are, I'll say, unremarkable expectations. And one of the key things that we like to talk about with Cover My Mental Health is we want to encourage you that these are completely reasonable expectations. They're not remarkable, and we're going to help you when these expectations aren't met. And the bottom line is, too often, these expectations are not met, and that's the whole point of Cover My Mental Health, is to be there at the point of, I'll say, at the point of crisis, or at the point of, what is going on here? And what do you mean it's not covered? Or what do you mean I can't find a provider? So this is, I'll say, a bit of a flyover of how the information that's on our website is organized. And the first thing that I think we provide is encouragement, which is to say, you don't have to take no for an answer, and it's completely reasonable, as I said, for you to expect certain things of your insurer. So we provide encouragement, ways to get started, and some tips for success. And I'll highlight a few of those. Then we talk about the specific obstacles. And our website has on the homepage some of the most common confounding obstacles, and we'll talk about those a little bit. And we talk about the sort of, I'll say, evidence or homework that you can do to be very focused about what the obstacle is. So I've had a number of people say to me as I've been, I'll say, out engaging with clinicians and parents and patients and their families, that when it comes to insurance companies, you just have to be aggressive, or you have to really be assertive. And I really don't think that that's a good construct, because I don't know how to teach be aggressive with an insurance company. What I have learned something about is how to help someone, or how to help myself to respond to an obstacle in a way that's just very logical and therefore very encouraging, and makes you, if not confident, at least self-assured that you're doing the right thing and you're in the right and the insurance company is not. And then on the far right side, I've identified some of the additional resources and additional steps that might be available, I'd say under the broad heading of if at first you don't succeed. So we certainly don't guarantee that the resources that we provide on this website are going to make all the insurance company problems go away. I wish I could say that they do that. What I can say is that our goal is to even the playing field so that it's, I'll say, closer to a fair fight. I don't even like to say fight, because that gets into the be aggressive stuff. But if you're more confident that you're in the right and you've got some tools on your side, that can make all the difference in the world. So, as I mentioned, one of the things that we offer as part of our, I'll say, encouragement program are a series of tips, and you can find these on the through the homepage under a button, how to use the site. And I want to just highlight one here, and it's the last one here: support from a friend or family member. So when you're facing a crisis for yourself or for a family member, sort of the last thing you need is another project. And the last thing you need is another project like deal with an insurance company on any level at all regarding the care. And so one possibility that I like to remind folks of, or maybe alert them to, is that every insurance company has a form that you can access, probably downloadable on their site, to authorize a friend or family member to act for you. And I think about times when our family was dealing with different challenges, and folks would say, "Hey, can we bring over dinner? Can we drive the carpool? Can we help you? And can we go grocery shopping?" And it could be that the answer to that question is, I really could use some help dealing with this insurance company. And it's not going to be every friend or family member who would be suited to task. And hopefully there might be one who can, I'll say, take this challenge or this burden off your hands when you've got something more important to do, like taking care of yourself or a family member. So it's really just a great reminder. It's out there. It's been there all along, and it's I'll say too easy to overlook. So phone a friend. Let's take a look first at the expectation that the insurance company is going to make you and give you access to an appropriate provider. So providers have network directories. You can typically find them online, and you're hunting for the right provider. And maybe the primary care physician, in the case of a mental health referral, can make some suggestions. But I'll say, just to keep it at a high level, the expectation you have is that there's going to be a provider available, and that you'll be able to find them close to home, and that you'll be able to get an appointment soon. So close to home, I'll say that could be based on, I'll say, your own experience. Is that miles or time? But I'm going to go with, you'll know what close is. If you're living in New Canaan, Boston is not close. And in terms of soon, if it's an emergency, then there's no question you're talking about going to the, I'll say, to the emergency room. So next year, or a month from Thursday, may not be soon. You'll know that. This is a huge issue. So we know from lots of sources, so policy nonprofits, certainly from press reports. ProPublica has done a lot of work in this area. These network directories are just not up to snuff. And it's not going to be a shock that if you need a certain type of mental health or substance use disorder care, you might not be able to find someone in network. So the I'll say suggestion that we offer is to download this worksheet, and it's available on our site. And I like to think of this as, show me your homework, right? So if you're looking for a clinician, it's, I think, completely reasonable that you're going to do the homework. You're going to look in the directory. You're going to find some names that look like they're nearby, and you're going to you'll call up and you'll start to look for an appointment. And the whole point of this form is to give you a framework to document your homework, which is to say, I looked up these, say, 5 individual providers, and I tried to reach them on such and such a date, and here's what I found out. They didn't answer the phone. They are no longer in network. They never were in the network. They're not taking new patients. They offered me an appointment, next, a year from July. And if you've done this homework, it's I don't say it's an easy, but it's an easier conversation with the insurance company to say, I've done my homework and now it's up to you to do yours. So don't tell me to go back to the directory and just try a little harder. Please provide me with an appointment, or please pay for my out-of-network care as if it were in network, and make me indifferent to your having a network that is just not up to snuff. Talked about the next two little arrows in my original chart. When it comes to coverage, you don't even think about it. Your expectation is that you're not going to be surprised. So you go to a clinician and they recommend a particular course of treatment or a particular medication. Your assumption is that it's going to be covered by insurance because that's what they do, right? They cover healthcare. And as you progress with the treatment, or as a family member progresses, the expectation is that the clinician or clinicians that you're working with have the most timely and specific information to be able to make decisions. And they'll make those decisions based on their training of what's optimal support for the patient to overcome their challenges, to recover, and to do so with as few risks as possible, managed in a clinically appropriate way, and for the duration of the required treatment. So what you don't expect is that the insurance company, from a distance and without benefit of any patient contact, is going to decide what it is that's necessary or not necessary. So for, I'll say, this particular obstacle, the most, I'll say, important phrase to be aware of is medical necessity. And it was actually when I was out in Connecticut and met Paul that I'd had a conversation with Andrew Gerber from Silver Hill. He's the CEO and I think medical director. And he said to me something that I hadn't quite put together. He said, when we go through our training, we learn do no harm, sort of the Hippocratic Oath, and we learn safe and effective. That's the sort of treatment we're supposed to provide. And we learn how to apply generally accepted standards. No one ever teaches us about medical necessity, right? So medical necessity is a legal term. It's not a clinical term. And when there's a gap between what an insurance company says it's going to cover, which in the contract, in the policy, is medical necessity, that's what it will say. And when there's a gap between that and what the clinician is trained and expert in deciding, that's when you get into trouble. So the image on the right here is from the Journal of Psychiatric Practice, as you can see, and it's an article that I co-authored from summer of 2021 with Mark Dubofsky, who's a litigator, Eric Placken, who was until the end of last year the medical director at Austin Riggs in Western Massachusetts. And we wrote this article because clinicians, as I'll say, as a general matter, don't know about medical necessity letters and how important they can be to help an individual who's facing a denial or anticipating a denial from an insurance company. So let's take a little closer look at this medical necessity letter idea. So the image on the left is the downloadable template that you can find on our website. The URL for the article that I showed you on the previous page, that's also available, and you can download that for free. So my fellow authors and I, when we had the article published, we said to the Journal of Psychiatric Practice, we want this to be available to anybody. And they said, well, it's behind a paywall. And we said, okay, how much does it cost to buy out the paywall forever? And so I'll say they made us an offer that we could readily accept. So it's available for anyone. And the contents of the medical necessity letter are summarized at right. And in a way, the letter itself, if you were to read through this template, get into some of the technical, I'll say clinical particulars that you would expect if a clinician was saying to an insurance company, hey, I'm totally capable of making this decision. I got this, right? And so what you'll find in the template is, first of all, a statement that the letter describes my clinical assessment and the medically necessary treatment for my patient. And it describes the relationship with the patient, describes the credentials, of, I went to medical school at XYZ, and this is my practice, and here's my assessment of this particular patient. Here are the clinical standards that I am using in this particular case, and how I've applied them. And then a statement of what's the medically necessary course of treatment. So you see, we're bridging a potential gap between what they're trained to do, which is to apply clinical standards, and medically necessary treatment. And so it's to put the onus back on the insurance company. If they want to say this care is not medically necessary, well, tell us what in this letter we got wrong, in your opinion, as opposed to just, we don't know what denial for medical necessity is all about. It's like, no, we're gonna put this sort of, I'll say, put a marker down that the person who's seeing the patient knows best. During Paul's introduction, he mentioned that, and I reiterated this lawsuit that we won. We had a medical necessity letter, and it was, I would say, crucial in the lawsuit. And the judge was able to see that we had documented the clinical decision making of our daughter's psychiatrist, and the insurance company hadn't. And so it wasn't even close, right? All right. So jumping to the last of the chevrons, when it comes to claims getting paid, your expectation is, you don't even think about your expectation. You just expect that it's gonna be covered. Now, I would say that's might be a little bit too generous, because in the meantime, there's a lot of concern about what's going to be covered or not covered. But when you buy an insurance policy, your basic expectation is that they're going to cover healthcare. That's the promise, right? That's the marketing slogan. And every insurance policy that I've ever seen or heard about says, if you have a dispute with us, just file an appeal. That's the way to resolve disputes, right? So a lot of what we provide on our website, Cover My Mental Health, is information, very specific, actionable information about other steps that are available before an appeal. So appeals can be an appropriate step at a certain point, with certain exceptions, and I would say emergencies might be one of those. Taking the step of filing an appeal first is not the way to go. There are other steps that you should take. You're not going to find them in the insurance policy. And I'll say, as a general matter, you're not going to find them anywhere else on the internet except for our website, Cover My Mental Health. Since we launched the site, I've learned, I'll say, even more ideas from talking to state regulators, federal regulators. I get great input from former insurance company executives. There are a lot of steps that you can take to deal with this, with a dispute. So one of the steps that can be taken, and we try to make it as absolutely easy as possible, is to ask your insurance company with a letter that looks like this, that you can download it from the website, and it's in Word. It's, I'll say, ready to be modified as you see fit and then sent in. It's to say to the insurance company, please send me my complete file, everything, call logs, all documentation. And so you're entitled to this by law, and they are obliged to respond. Now, that response could be quite long. I had a situation, we were dealing with a dispute related to some care our son needed, and I sent this letter in, and I got a stack of paper about 2.5 inches high, and it was quite useful, right? So it had a copy of the entire policy. That was the bulk of the paperwork, and it had the clinical notes from their external reviewer. And those external notes said very, very clearly that the care our son needed was medically necessary. And so that helped to overcome a denial that they had made and we've made a partial success there, and we're still disputing part of what they are dragging their feet on. When I made a similar request for our daughter's care, what came back and was interesting was no information that disputed the medical necessity. They didn't have the documentation. And what they did have was a note from their external psychiatrist that was a fabrication of a conversation that he had allegedly with our daughter's therapist. But I had the notes from our daughter's therapist. I had her call log, and it was just a fraud. And so by virtue of what they didn't have, it really made a difference for us. Another step that can be very helpful is what's called a formal complaint. So a formal insurer complaint. So this is not an appeal. It's a different sort of administrative process for insurance companies. And here's what's important about this. So insurers have to treat complaints in a very particular way. They have to file a notice to their state regulator when they receive a complaint, and they have to, or let's say after they receive a complaint, and they have to tell the regulator how it was handled. They also have to report a complaint to their accreditation organization, which is likely to be an organization called NCQA. They don't like that. They don't like to have to report a complaint, and they don't like to report a complaint that was not resolved in an appropriate way. So as it turns out, saying to a customer service rep, I want to file a formal complaint, not an appeal, a complaint. And it's for a quality of care failure. That's the key phrase, quality of care failure. And the template on the right, you can, by now you know the pattern, you can download this from our website, provides a follow-up letter that you can document the conversation that you had over the phone. You might have said, I'm going to send you a copy or another copy of a medical necessity letter. I'm going to share with you a worksheet showing that I tried to find a provider and I cannot find a provider in my network, and you haven't resolved that for me. That's something, by the way, you can't even appeal. So appeals are useless if you can't find an in-network provider because there's nothing denied. You didn't even get the care, right? So having taken this step, it's a different, you're initiating a different workflow within the insurance company that might do the trick to break down the barriers that are standing in the way. And if they don't, this is a helpful step to be able to point to with some of the other steps that I'll talk about in just a few minutes, to be able to say, I filed a medical necessity letter, didn't do the trick. I filed a formal complaint for a quality of care failure to provide medically necessary care, didn't do the trick. So I'm being diligent here, and the insurance company is being wrong and obstinate. That's the key. So who else can you ask for help? So there are three identified here. Two are the state and federal regulators. And I'd say the federal regulators are, I'd say, really terrific in my experience. They're very committed to helping, and they've got people all around the country that will work with you. State regulators, the same. I'd say the caution is it may not go as fast as you would like. The step that I think could be the most interesting is to call an elected official, either state or federal. So your senator, your House of Representatives, or assembly person, and say, I've done my homework. I've got a medical necessity letter, say, I filed a formal complaint for quality of care failure, and this is just not working. And the constituent services folks in the office of your, say, senator or representative, they can help you. And I was giving a talk in El Paso in November to a group of mental health advocates, and a woman who was in this workshop stood up and said, "This is exactly right. It's exactly what I do." She works in the Texas legislature, and afterwards, it was just an on-the-spot endorsement. And afterwards, I asked her if I could film her saying this, and she said yes. And you can find this on the website. This woman is just a perfect voice for call. We love to help. That's and I can also say I've talked to many insurance company industry executives, former, and they say nothing causes us to pay attention more than if we get a call from Senator so-and-so's office. So take advantage of that. Okay, so Paul, I can maybe hit just a couple of more points and then let's open it up for questions if that's all right.
Sounds good.
Okay. By the way, I'll provide these slides to Paul and he can make them available to everyone afterwards. So let's talk about appeals, the one step that you'll find in an insurance policy. So it could very well be that none of the steps that I've described so far get the job done, and you don't have options beyond filing an appeal, and so that seems to be the right step. These are 5 really important things to know, and you can learn more about this on the website. So appeals are legal actions. They're not to be taken casually. They are your opportunity to provide evidence. And when I say that, I mean all the evidence. So some websites will say, if you're going to write an appeal, be sure it's concise and really say how important it is to your family. And I would say the insurance company doesn't really care how important it is to your family. So stick to the evidence. And being concise is exactly the wrong advice. So I should say that I'm not a lawyer and I'm not providing legal advice, but I'll say this. This is the time to include everything. Copy of the policy, copy of every explanation of benefits, all correspondence, everything. Because the appeal is going to be reviewed and potentially subsequently reviewed based on the evidence that's submitted. So it's your chance to load up. And your insurance policy will also define exactly what the process is that you have to follow and the timeline and so on. And you'll want to follow that so that you, I'll say, check all the boxes that they want you to check. All right, I'm going to maybe skip over these next 2 slides on single case agreements, other than to say it's a known term of art within the insurance world. It's an agreed exception, and you can learn more about what that looks like on the website. You're not going to learn about it in the insurance policy. You have to ask for it. And we have some information about the recipe for a successful lawsuit. So the spoiler alert is it's really, really hard. And so don't think that's going to be the way to go. So here's my headlines. Your reasonable health insurance expectations, they're reasonable. Our website provides encouragement and resources. Medical necessity letters are, I like to say, it's your secret weapon. There's help available from a variety of different resources that you may or may not have thought about. And if at first you don't succeed, there are things that you can still do. So I'll stop here, and I'll just say that if you're interested in just taking this a very brief survey so that I get some feedback about how I did, and more importantly, I'd say areas that would be of interest in the future as I try to develop the presentation to be helpful. So thanks so much.
Well, once our group gets going, they're usually they're not shy about questions they might have. And I think the idea of the medical necessity letter is pretty new. But Andrew, did you have a question?
Yeah, we have a few. Hi, Paul. Hi, Joe. Thank you for giving us all this information. My question is, my son was under my insurance through my employment, and he's now 20, he's over 26, and they now denied him coverage. Although my employment is willing to pay for it, they just said because of his age. Anyway, we sent the forms they needed, doctor's notes, what have you, and they still denied it. My question is, my son is currently on disability through his employment. He works part-time. So he now has Medicare, which I don't know how that really works because he just quit his job. So does that disability get knocked off? And then does this approach work for trying to get him back on my coverage through my employment? Sorry if it's confusing.
No. Well, it's let's say this. It's what's clear is you've got a lot of moving parts, right?
Right.
So I'll make a few observations, and I'll say try to be helpful. I can say that when you've got multiple competing or maybe overlapping insurance coverage, that can be challenging. The thing that you said that I thought was most promising was that your employer was willing to cover.
Yeah.
So if it's a large company that is what they call self-insured, meaning that they have the ultimate responsibility for paying the claims, it's being administered through an organization that looks like an insurance company, that can be, I'll say, that has the potential to be effective if the contract that you have or the letter that you have from your employer says, we're going to cover this, period. And it's defined exactly what's covered. It can mention that notwithstanding that your son is more than 26 and therefore would not normally be on the plan, that they waive that limitation. And therefore claims that are processed through this administrator. So it looks like an insurance company from the outside, but they're really administering it on behalf of the employer. That, I'll say, from the outside looking in and not trying to provide you with legal advice, that would seem to be I'll say, clear and simpler path for his care to be covered, right?
Okay.
So the summary would be, if your employer says, not in effect, but it says in a letter, we don't care that he's 26. We don't care that he had coverage through his employment. We don't care that he's on Medicaid. We're responsible, and the care that we're responsible for is ABC. Then the organization that looks like an insurance company but is really just an administrator, they should accept that, and someone in the I'll say human resources or benefits department should be able to help run communication on your behalf to say, yep, we're good, we're covering it.
Okay.
So you don't have to do anything about judging medical necessity or whatever.
Okay.
We've got it covered.
Thank you.
That would be based on what you said, that would be my path of least resistance.
Okay. And I have one more question. How far back can you go with, like, say if something happened 3 years ago, I made the mistake of filing an appeal because everything was always denied for my son. How far back can you go with using your approach?
So that will depend on certainly the limitations that are in the policy. It may also depend on, so if it's an employer-based plan, it would depend on the federal regulations. And so
Even if I'm no
looking into that.
longer with that employment, even if I'm no longer there and it happened like, with a previous coverage or.
If it, I don't think it's going to matter whether you're still there or not. If they were the insurer, or it was the health plan, I'll say, of record at the time that you were that you're talking about, they would still be relevant.
Okay.
Yeah, I think talking to a federal regulator, so that 844 call EBSA is the number. It'll be in the materials.
Okay.
Maybe helpful. So when you have, so I'll maybe point out one thing that is maybe helpful, or maybe also helpful. So as much as an insurance policy may say, you have 90 days or you have 1 year, there may be flexibility, or there might be some different possibilities. So COVID resulted in some states and some plans waiving the defined periods for looking back at claims. That may or may not apply here. It's something to look into.
Okay.
The other is, to the extent that you didn't understand or that it was made unclear, that may be in your, I'll say, helpful to you when you talk to, let's say, a constituent services organization or a state or federal regulator, to say, here's what I did, and I didn't understand X, Y, Z, and I had no reasonable reason to understand the technicality there. And to be candid, it could be that it's just too late. There's just not enough of a basis for looking back.
Okay. Thank you very much.
Cindy?
Yeah, good evening. I'm not part of the parent group, and actually am zooming in from outside of Philadelphia, where we are cold as well. I just wanted to say thank you. I'm a certified family recovery specialist. I have a son who's 37 in recovery, and been on that joint recovery journey since he was 14. So this was great information that I intend to share. I used to facilitate a group for over 10 years, parents, and still maintain an email group of over 200, and different people approach me at different times to be added, just sending out information. And it could be about substance use, mental health, grand families, incarceration, all the things that kind of follow mental health and SUD. But anyways, I just wanted to say thank you. It was great info, and not info in my 20 plus years that I've ever heard. I did participate in a workshop done by the Pennsylvania Insurance Police, I'll call them. And one of their biggest complaints was they never hear from consumers when there's a challenge. Like they could count on one hand the number of complaints they get. But when you talk to people, there's a lot of complaints, and people don't necessarily go to the right agencies to get the help that they might be able to offer. So thank you.
No, Cindy, thank you. So through my, I'll say, one of the activities that I'm involved in is serving as what's called a consumer representative to the National Association of Insurance Commissioners. So it's the sort of talking shop for state insurance regulators. And if you like that sort of thing, it's kind of a kid in a candy store getting to interact with these state regulators from all over the country. And I hear from them exactly what you said. We just don't get that many complaints from consumers. By the way, they also say we get virtually no complaints from clinicians, which is a big issue. What they hear about is activity when they are out in the market doing what they call a market conduct review. So they are proactively trying to, say, sort of, get people to tell their stories. But no, they don't hear because people give up, right? And I mean, that's the whole point of what we're trying to do, is to say, like I have said many times, is encourage people. You don't have to take no for an answer. So, and if you want to, this is an offer, Cindy, I'll say for you, but for anyone, if you want to reach out to me at this email address, I'm happy to share share not only this presentation, but other information that you might share with, I'll say, broader communities to make people aware of the resource. That's the way we're going to be able to help more people.
And Joe, are you willing to do this type of virtual presentation to possibly some other entities?
Yep.
Yeah, I'm just because again, it's been 20 plus years, just connected with a lot of different things and mostly in my own area. And I think this is just really valuable information. So thanks again. And I'll be in touch.
Sure. Thank you. Okay,
Cindy,
great. Thank you.
Cindy, I think you are connected with be a part of the conversation. Is that right? And
be a part of the conversation. Used to serve on the Pennsylvania Parent Advisory Group for NAMI in my county. So yeah, I know Kim Porter. She does excellent stuff.
yeah, I'd love to give Kim, Joe's name, just because I've taken so many names from Kim and done pathway sessions based on, I'd like to return the favor to her and say, hey, Kim, I have somebody for you, a good speaker. So anyway, thanks, Cindy.
Yep. Thank you.
Joe, one question I had was on in-network. You're referring to that a lot, but it seems almost like some parents, and I'd like to hear if any parents have a view on this, that they're almost indifferent between, oh, okay, I'm going to get an in-network treatment center for my son. Say that the son has SUD and needs treatment. And there's that, and they go, oh, this is great. It's in network. I'll hardly have to pay anything. And then there's ones that aren't in network, but their plan will pay a certain amount, say 40%, and then they just approach the treatment center and say, this is what our coverage is, and they work out a deal. And again, they don't really have to pay that much. And so it's almost like it's not so big a deal to be in network, especially when a lot of the in-network resources are not really great. There seem to be lower quality in network, at least that had been the trend. And I think some of our parents have a view on that, but what do you have to say, Joe?
Yeah, so I'll say the phenomenon that you've described, I've certainly heard from others. I think I'll say trust but verify is a great mantra, right? So, I see different treatment facilities of all different flavors saying that we're in XYZ insurance company's network, and so that can be confusing, right? Because you think, okay, then we're good to go, it's covered, and it doesn't necessarily mean that. It probably can be relied on more if you're talking about outpatient care. I'll say something closer to, I'll say routine. I don't mean to diminish its significance, but routine outpatient care, the issues around insurance coverage there are way less than for higher levels of care, intensive outpatient, partial hospitalization, residential, inpatient. That's where the gap between medical necessity and generally accepted standards risks becoming big, right? So asking, what does it mean that it's in network, and what can you do to give me confidence that of what my financial exposure is going to be? Those are all really reasonable questions to ask. And I think I'll say with reputable providers, they'll tell you what they know, and and you have to listen. I'll say listen with a certain amount of I don't know if skepticism is the right word, but just caution that when they say, we have really good luck with approvals, that can be good, but if that's not something that's clear enough that you can rely on it, then you have to make a decision. Another thing that's, I think, really interesting, and I've heard more and more talk about this just in the last couple of months, is that prior authorizations may or may not mean what you think they mean. Prior, before, authorization, approved, right? And I know that from my own experience where family member had 21 days of inpatient or residential approved, prior authorized, and then the explanation of benefits said, we'll cover 7 of the 21, right? So, let's say this, I didn't know quite what to believe, and I asked the folks, what does this prior authorization cover anyway? And they said, well, we really don't know. We don't know. You'll find out later. And I said, okay, well, I'll better get a medical necessity letter because I can't rely on that. And it's a good thing I had it, right?
Yeah, thanks. Trudy or Nicole or Rich, do any of you have a view on, in-network versus out-of-network?
Yeah, I mean, I can speak to that a little bit, Paul. As you know, I have worked in the treatment world and have worked at several inpatient treatment facilities. And even the insurance approvals, it's very, very difficult on the patient themselves, because if they're in treatment, trying to focus on their programming and recovery, if they're not sure that they're going to be there tomorrow or a week from now, because they're waking up every morning wondering if, their insurance company is going to cover another 3 days or whatever, it's really detrimental to the work that they're trying to do. Without bad mouthing some treatment programs, I mean, I've always been very particular about where I've worked, but a lot of the treatment programs will know the ins and outs of what the coverage is and will work their programming around it. So yeah, it's really tough. And I agreed, Joe mentioned earlier, none of us should ever accept the word no from their insurer. As Joe and Paul know, I'm one of the parents similar to Joe that I did end up suing Blue Cross of Massachusetts. And lucky like Joe, won my case, but it was a very, very long process. And I always say, you also have your state attorney generals to fall back on, which is where I ended up eventually going. So I never had to pay for any legal coverage because the state attorney general was free.
Interesting.
Yeah. Thanks for mentioning that, Trudy. So I need to have that included as I'll say a specific point. Because the state attorneys general can sometimes be very helpful. I think there's a lot more variability there. I think some states it's great, some states not so much. It can be a great step.
Yeah. Definitely a good point about some treatment centers really being on top of insurance. And I do know Trudy worked for a long time at Karen. That's one of her places. Anybody else, I know everybody on this call, and hopefully they took some good notes. And we have Nicole.
I'll ask a question. I mean, I wish I had this many years ago. But my son is in an IOP right now, and the program says that insurance won't pay for more than 2 months with them. It's the first time in 8 years my son is sober, and I don't know if it's this program or not, but we want him to stay longer. So they just sent us a self-pay form. It was like, all right, from now on, you're self-pay. And is it do you think, given that situation, that's something I could try to get insurance to cover more than 2 months.
So again, just I'll say speculating on this without having all the details and the like. If it's is this private insurance?
Yes.
Yeah. So with private insurance, there are I'll say a lot of consumer-friendly protections around treatment limitations that made limitations on like lifetime number of days or the like illegal. And so I think it, you know, I'd say especially if they've sent you documentation, not just a self-pay form, but a letter that says, here's a specific limitation that we are imposing, to then have a conversation. I would say that's something to talk to the federal regulatory resource that I had on the screen. This it's a part of the Department of Labor called EBSA, and their whole job is to help people with employee benefits. And I think that's a fair question to ask them. Now, they may be able to tell you that there's something, I'll say, particular about that insurance policy or some other aspect. You know, I'll say, again, knowing nothing more than what you described, sounds like there's an opportunity for a clinician who's taking care of your son under an intensive outpatient to say, I've been working with Nicole's son, and this care is medically necessary with the, I'll say the overall context of the letter that we talked about earlier, and then to pursue the path. And you might, in this case, call this federal regulator maybe earlier to just see if they tell you if they give you, I'll say, bright line guidance that, yep, they cannot limit the number of days. There's certainly, I've come to learn, so I'm not an expert in Medicaid and Medicare. I understand that there are lifetime limitations that can come into play there. But since you're not talking about that, that sounds like, I'll say, an insurer behaving badly.
Thank you. Thank you for the presentation. Amazing.
Thanks.
We have time for one more if there is one, but there might not be. And that's okay too. And there's a lot to digest on the website. I definitely recommend people go there. So
if I can maybe just before you close out,
yeah.
Paul, if I could just say that these kind of conversations to me are just really inspiring, because what I know is I learned everything that I learned just along the way. And the whole goal of this is to take, I'll say, a little bit of wisdom that I picked up along the way, but more importantly, a lot of wisdom I've learned from a lot of people who've helped me, and to put it in a package that's easy to understand. There's no quiz at the end, and there's no legal requirement of any kind. There's no, the law is on your side, don't worry, because it doesn't help. And anybody has any suggestions for not just this presentation, but anything that we can include on the website that might be a little bit more helpful, we're all ears. We want to make it as robust as possible and spread the word. Really helpful.
Okay.
Thanks so much.
Great, Joe. And just one question maybe for Trudy or Joe. What about Patrick Kennedy? Do you think he may have more impact in coming months and years with, you know, and it maybe isn't even dependent on what the administration is in power at a particular time?
I'll give you my 2 cents. Don't wait for that. So I've had the good fortune of collaborating with Patrick for 6 years, and he's a big fan of Cover My Mental Health. And there's a lot going on in the federal government that is, I'll say, heading in the right direction. It just takes too long for anybody whose family's got a need. It just takes too long. And so I testified last year in front of the state legislature here in Illinois. It looks like I may have another chance to do that here. I'll continue to do that kind of work, but it just takes too long. And what I understand from talking to, I'll say, contacts who, one just left the administration on Monday about 11:50, and another who's still there. What I understand is they are squeezed for resources for enforcing federal laws and regulations, really squeezed. 2.7 million plans that they administer or that they oversee, and about 800 people. And it's not the only thing that they do. So and Congress is going to squeeze them even more. And that was regardless of whether, whoever got elected president. So wish them well, support them, and vote as you might for politicians. And I think Connecticut has got some great advocates at the state level. Sean Scanlon, your comptroller, is awesome. He is absolutely awesome. But the cavalry is not coming to help you.
And I'll add to that, Paul. I always describe myself as wearing two hats, wearing my professional hat, having worked in the industry for many, many years, but then also wearing my mother's hat. And in most cases of advocacy, it's my mother's hat that carries the most weight.
Wow. Maybe on that note, we will end it. And but that sounds very hopeful. So thanks a lot. Joe, I really appreciate you being here tonight.
Thanks, everybody.
Thank you.
All the best. Have a good evening and stay warm.